presentation. We've had a lot of people registered, so I'm super excited to introduce you to Dr. Heather Finlay-Morreale. She will be conducting today's presentation about making the most of your doctor appointments. I think based upon, the activity in social media, what I'm seeing, and just being an MG patient myself, I understand how important this topic is. So I would like to quickly introduce you to Dr. Finlay-Morreale. Dr. Finlay-Morreale is a physician, an MG patient, a writer and a storyteller, artist, and an advocate. Her work focuses on the humanity and dignity of all the cogs in the medical machine, both patients and caregivers. Dr. Finlay-Morreale earned her medical degree at the University of Cincinnati, conducted her residency at Tufts, and was the L Scholar at Northeastern University. Heather was also a Doximity Writing Fellow and has a featured blog on Doximity's Med. Her writing has been featured on numerous publications, as you can tell. And she's also been featured on multiple podcasts on Spotify and Moss-style storytelling events. Dr. Finlay-Morreale currently serves as Assistant Professor of Pediatrics at the University of Massachusetts Chan Medical School. And before I hand it over to Dr. Finlay-Morreale, I wanted to take a moment to thank all of our sponsors for being a part of today's webinar. Our national presenting sponsors, Alexion and Argenx, our national collaborators, Amgen, national sponsors, UCB, and Janssen. So I'm going to go ahead and stop sharing my screen, and Dr. Finlay-Morreale, I will hand it over to you. Sorry, Dr. Morreale, I think you're on mute.
Okay, there we go. Speaker mode is a little different than regular mode. Thanks for inviting me. I'm happy to be here and to talk about this topic. I do think it's an important topic. I do hear a lot of questions on how to make the most of doctor's appointments. And so I'm going to address that from kind of a dual perspective of being both a physician and a patient and having had a lot of doctor's appointments myself. I have no financial disclosures, and nothing I say is medical advice, naturally. So I'm going to talk a little bit at the beginning about kind of my path and my journey, since that frames my opinions and thoughts about how to manage doctor's visits. So I had kind of an unusual path to medicine. I was in veterinary medicine and then teaching and then research before medical school. I had 8 years after college before I went to medical school. Kind of over this time, I developed neurological Sjogren's, and then later in 2020, I developed Myasthenia gravis, although it was not really diagnosed and treated until 2022. And kind of woven throughout all of this time, I've used art, writing, and advocacy kind of as like coping strategies, actually. So kind of my real introduction to invisible illness was when I developed torso neuralgia, likely related to Sjogren's or shingles. And so it kind of felt like there was a spear in my right side. It was a really severe pain, lasted about 2.5 years, actually. And so it was my first experience kind of navigating the world with a severe disorder that's invisible to people. And then later on, I developed POTS and dysautonomia, so kind of my whole body wiring was off. And then how I actually ended up finding help was almost through Dr. Google, even though I was a physician myself. A friend referred me to a YouTube video of a doctor speaking at a conference, which led me to then get a biopsy, and I was diagnosed with small fiber neuropathy from Sjogren's. So I think kind of those years really changed how I viewed the medical profession. Once I was diagnosed with the small fiber neuropathy, I started IVIG, and that's a picture of the box that came to my house and everything that was in it to start my IVIG, and kind of all the meds in a week. And it's really overwhelming being a patient. Just being a patient is a full-time job on its own sometimes. It helped. I got better. I was working mostly in primary care in a pediatric office, did some work in the ER, pediatric ER as well, up until the start of COVID. And it would have been nice if that was kind of the end of my medical journey, but it wasn't. It was kind of a little bit of the beginning. So I developed all these new symptoms. I had a really hard time walking. I would walk a a short distance and then get really weak and just have to sit down. Um, I got blurred vision in the evenings in particular. I was really short of breath, even at rest. And it was even worse if I would just walk across a room. And I started sleeping on 1 pillow and 2 pillow and 3 pillow. And then I was actually sleeping, sitting 90 degrees up against the headboard, because if I laid down, I couldn't breathe. And I was choking. And I had a lot of tests and they were all normal. My echo was normal, my MRI was normal, normal. But I think, like a lot of us, normal tests were not reassuring because I knew something was wrong. And, until you get an abnormal test, you can't get treated. So that was a bit of my experience for a while, lots of normal tests. So the last test that I had, or one of the last tests, was a stress exercise test called the CPET, where I exercised as hard. I was told to exercise until I absolutely could not continue. So I biked extremely slowly. That was all I could manage for about 2 minutes. And then I collapsed. I couldn't do anymore. And then when I got home, I couldn't lay down and breathe. I was really kind of huffing and puffing and working really hard to breathe, and couldn't really move my arms and legs. They felt super heavy, and it kind of took monumental mental and physical effort to really move my arms and legs. So I went to the ER. And I was in the waiting room and I was having a really hard time breathing, and I was kind of going through the motions of respiratory distress without having been taught them. It was really strange, but in med school, you kind of realize these different postures that people go through. And I was going through all of them. And in the waiting room, I passed out one time while I was waiting, came back to, and then with all the heavy breathing, I started to have periods of apnea. And when I would struggle and struggle and struggle, and then I would stop breathing for a while, and it actually felt restful, kind of like a little oasis from the struggle, which was really alarming and scary to me. So I sent my husband over to the triage nurse, to say I was getting worse. And she came over and looked at me and she said, just try harder to breathe normal, which was not very effective. I passed out again as they were wheeling me back to see the doctors. And when I got back into the treatment room, my pulse ox was normal, as we all know, because it can be normal until it's not normal anymore. And the doctor said to me, ERs can't solve all people's problems. Go home and solve your own problems. Since my problem was I couldn't breathe or move my arms and legs, I didn't think going home was safe. So I actually refused to discharge. And then they put me in a room in the dark, shut the door. I didn't have a call light. I couldn't really breathe. I couldn't really move my arms and legs. And no one came into that room for 6 hours. I was admitted. I stayed in the hospital a week, but I never saw a neurologist. I was started on pyridostigmine or Mestinon, but that was for POTS and ME. It wasn't for myasthenia, but it probably was kind of what saved me during that admission. I spent a lot of 2021 in the hospital, I think 4 weeks, 6 weeks, something like that, which just is absolutely maddening to me. It drives me crazy being inpatient in the hospital, but I had a lot of medical complications. I had sepsis, I had kidney failure, I got a PE from the IVIG. So it was a pretty rough year. And then I did have to stop working. I lost friendships, kind of as it says here. I had to kind of accept a new way of life. I couldn't do a lot of the things that I used to be able to do. And my world got really, really small because although I was on pyridostigmine, I wasn't on enough and the timing wasn't right. It was just dosed differently for POTS than it is for myasthenia. So I was pretty much stuck in bed for almost 2 years. I did, through kind of this odd and fortunate twist of events, get diagnosed with seronegative MG. And so part of my art is I use all this found paper you get from insurance companies and with your prescriptions, and you just get this like stack. So I use it in collages and, different pieces of artwork. I ended up getting a power wheelchair. So I was able to leave the house on good days, which was great. Kind of opened the world up a little bit. And I think on my screen, the quote is a little bit blocked because of the speaker's faces. So it's a quote from Michael J. Fox, and it says, "Acceptance doesn't mean resignation. It means understanding that something is what it is, and there's got to be a way through it." So I had kind of a mental mind shift as a result of getting really sick. So now that I'm treated, I have improved to some degree. And on good days and when invited, I talk to doctors. I kind of talk about the 5 steps to be the doctor you hope you would have if you ever get really sick. And the first step is meeting patients with kind of a clean slate and fresh eyes. I advise the doctors to listen curiously to patients, always believe what patients say without any kind of yeah, but after it, just believe the patient, think about their problem and help them. So I've been fortunate enough that I've been able to do this sort of in journals for doctors and at, medical schools and things like that. I've had to change my pace a little bit, kind of doctor life. When you actually take a break is when you're like way over empty and like totally in the red zone. But with MG, you kind of have to take a break when you're halfway to your limit, or, kind of just doing medium, take a break. And so I walk really slow now. And so actually my husband calls it power tortoise mode, as I kind of shuffle along with my walker. So now that I've kind of talked about my story, I'm going to talk a little bit on how to manage medical appointments, give you a little bit of the insight on what will help you and your doctor be the best partners so that you can communicate effectively and get the best treatment ultimately. So I'll talk about these kind of in the rest of the talk. One thing is you really prepare. You want to go into that appointment with a list of your meds, a list of your diagnoses, how you've been doing, your goals. Don't just go in kind of empty. You want to know what you want to accomplish during that visit. Get all of your stuff together. One thing I do in between appointments is I have a little note in my phone that's kind of like a to do at the doctor note, so that when, just sitting there and a question pops up, I type it in that note so that when I'm at the doctor 4 months later, I remember it. I keep a note of really key dates, like when I go down on my story taper, what the dates are, or dates of really big, like medical events, just to keep it all handy so that you have it available when you're at the appointment. So for your list of meds, it's good to have both names, the brand name and the generic name. In medical school now, they only teach you the generic name. And so especially younger doctors and nurses and other health professionals may only know the generic name. So they may know pyridostigmine, for example, and not Mestinon. You want to write down how much you take and how often. For meds that are not from the doctor you're with at the moment, what doctor prescribes that med and what the med is for. A lot of medicines have a lot of different uses. And so it's important to know why you're taking each medicine. You want to include supplements, like coenzyme Q, or if you're taking any other supplements, if you're taking like CBD or THC, that would be important to mention so that your doctor knows. And then it's also good to keep a list of meds that you've tried that didn't work out. When you apply to insurance for newer infusions or newer medicines, insurance wants to know what you've tried that's cheaper and if it worked or not. So it's good to kind of keep a running tally of what meds you've tried that didn't work out. You want to have a list of your top 3 questions. Time is limited. We don't get as much time in visits as we would like. And I think that's true for both doctors and patients. They would say that. So it's good to have priority over what questions you're going to ask. So what are some good questions? When you come in, you're going to give an update. I think I skipped a slide. You'll have to give me a little grace for doing presentations when you're unwell with MG sometimes. But when you first go into the visit, you're going to give an update of how you've been since you saw the doctor last. And you want to give, if you can, really specific examples that are functional, how you do things, and that are objective, not I feel weak or my arms are weak, but I used to lift my 50-pound Labrador into the backseat of my car and now I can't carry a bag of groceries. So the more specific and objective examples you give, I think is more likely for a physician or another healthcare provider to listen to you and believe you, and to know exactly what you mean. It's different to say I'm weak and I'm tired. I'm in my 40s, of course I'm weak and tired compared to my 20s, but if you give really specific examples, that's really helpful. So to go back to good questions, what do you think my diagnosis is? I think sometimes people think they're generalized or progressing to generalized MG, but the doctor thinks it's still ocular, or maybe the patient thinks at that visit they're diagnosed with MG, but they get home and look at the note and they're not. So I think if this pertains to you, you might want to ask, what are you giving me as my diagnosis, or what's on your list of potentials right now? If a new med is being started, you want to know about the side effects. How long until it works? Is it like pyrrolostigmine that works right away? Is it more like mycophenolate or Cellcept where it could be months and months? You're going to want to know if a new med suppresses your immune system. If you need any blood work or vaccines or preventative antibiotics, anything else that goes along with taking that med, you want to know before you start it. Tests like EMGs or single fibers, blood tests. You want to go over your results and ask the doctor, what does this result mean? Or for a future test, why are you running this test? Will this test rule something in, rule something out, tell you if I'm getting better or worse? When you leave the visit, any tests that kind of you're there to discuss, you want to be sure you understand them. And then it's also good to ask, when do I go to the ER versus call the on-call doctor? Is there an on-call doctor for your office? In my state, it's a law, there has to be an on-call doctor, but there are still some doctors that don't follow that. And if they want you to go to the ER for XYZ symptom, which hospital should you go to? Because there can be a lot of variety in resources at different hospitals. Some may have a neurologist 24/7, some may not have a neurologist other than business hours. In addition to your top 3 questions, you might want to have top 3 reasons you're going to the doctor. Kind of the same thing. What are your top 3 specific goals? Again, because there's limited time, so you got to focus. You might want to put your past health history into a health resume or summary. That's 1 page, not the binder, not the huge binder of papers that you got to shuffle through. I think we all can often have a pretty long history by the time we end up at the specialist neurologist office, but if you can put on 1 page your meds, your diagnoses, key important tests, things like that. And if that's hard for you to put together, maybe look within your family group or your social group to see if there's a nurse or a doctor or a physical therapist, someone that can help you put together this 1 page summary. Having 2 eyes and 2 brains put together, I think can be really helpful. And I have a 1 page summary myself that I bring to new patient appointments because, yeah, it's in the electronic medical record, but there's a lot of garbage in there too. I mean, there's page and page and page. I went to the ER, I was there 24 hours, and the note from the ER was 58 pages long. And most of it was garbage, like computer notes and, strange things like that. So summarized to 1 page is fantastic. So here's logistics. Before you show up at the visit, do they have the referral? You don't want to get there and get sent home. You need to get together any forms that you need signed, like FMLA forms or disability forms or any kind of form or paperwork. If you want to show pictures or videos, have them queued up and ready. I tend to bring, if I have a picture or video, an iPad that's only for the picture or video, and it's like all queued up. Another logistic prep, do you need any refills or medications? And then this is really key. You want to get there early. So how long is it going to take you to get there early at the time and day of your appointment? Is it rush hour or whatnot? So you can actually go to Google and type in your address and where you're going. And then if you see it says arrive by, depart by, or leave now, it's a drop down. You can type in how long it's going to take to get somewhere at 3 o'clock on that day in the city. It's super helpful. So I'm going to talk a little bit about on the day of the visit. So I think it's important to manage kind of the anxiety, stress, fear that can come up when you have a new doctor's appointment or when you are concerned about a doctor's appointment, because I think a lot of us have been through kind of the graphic on the left, the diagnostic journey with a rare illness, where you see one doctor, you have a normal test, you go over here, but they don't listen to you. And then, I think I can't read a lot of scientific papers these days, but I read one last year and it was a good one. And it was centered in Europe. But it said the average time to diagnosis for MG patients was a little over 10 months. I would say it's probably a lot longer for seronegative MG patients. And 35% were given the wrong diagnosis before they were given the diagnosis of MG. And some of the main misdiagnoses was ME/CFS, and they actually called it hysteria in this journal article. So if you spent 10 months being told you're just tired and hysterical, it makes sense that you might be really anxious about a new appointment. So it's happened to me. I sent myself into a flare one time when I was seeing a new doctor. So if you can, try to do nothing else stressful that day. Try to relax that day. You don't want to be rushing from one thing to one thing to one thing, and then you're sitting in the doctor's office. I think it's good to have reasonable expectations of the visit. If you're seeing a PCP, they're not likely to prescribe you pyridostigmine or diagnose you with MG. So reasonable expectations for that particular provider on that day. I think it's good not to fixate that there's only one good possible outcome of that visit. I think just like I tell doctors to meet patients with a clean slate, it's good to meet a new doctor with a clean slate as well. It's good to be honest. So sometimes you can bring someone with you, and then you want to be nice to the secretaries and the MAs as well, just because it's the right thing to do. And I know when I was a physician, sometimes I was surprised that some families would kind of be verbally abusive with the staff, and that's just not cool. So how does your doctor get ready for the visit? So we're trained to write a certain kind of note, and it's SOAP, Subjective Objective Assessment Plan. So under subjective, that's what you say in your, update, your history. I can't lift my dog anymore. I'm so tired, I had to reduce my hours at work, kind of what you're reporting. And the more functional examples, the better. And then under objective, your doctor wants lab results. They want EMGs, they want MRI. So objective, you want to have some info that's objective, if you have it, to communicate it to the doctor, especially if you had lab work or imaging done somewhere else other than where they're working. And then in the note, the doctor writes their assessment, what they think is going on with you, and their plan. We all have rights, rights as a patient and also a person with a disability. Disability by the CDC doesn't really relate to whether you're working or not. It's whether your kind of daily life skills are affected by whatever condition you have. So I would say a lot of people with MG do qualify as a person with a disability. So you have a right to barrier-free access to see that provider, an interpreter or a translator that is not out of your own pocket. The doctor is actually legally required to provide an interpreter or a translator for you. And you have a right to a support person like a PCA or a spouse or somebody else to help you at the appointment. And then along with rights are responsibilities. Most hospitals now have a code of conduct. You don't want to get upset at the appointment and start throwing F-bombs at the doctor, getting verbally abusive or getting really riled up or things like that, because that will get you banned from that hospital system. Once you're there, you're in the room, you got there early. I get there super, super early to appointments just because, here in Boston, if it rains, forget about it. The Pike's a nightmare. So I might show up like an hour early just to make sure. You're prepped, you've got all your stuff. You want to show the doctor your top 3 goals or your top 3 questions at the start of the visit. Here they are. These are my top 3 questions, my top 3 goals. And you want to avoid what doctors call the doorknob question, which is when they're leaving and they're turning the door to leave. And you're like, but, here's my 10 questions. So kind of present your agenda at the start. We've talked about specific examples already. Focus on your top concerns, goals. And it doesn't really help to spend a lot of time complaining about prior visits. You know, you only get so many minutes in that room with that doctor for them to listen to you. And it's not going to help you meet your goals to talk about the past. Before you leave the appointment, you want to kind of understand the diagnosis. If it's a new diagnosis visit, what are they diagnosing you with? Any medical changes that are going to be made? Am I going to start a new medicine? Am I going to stop a medicine? You know, what their plan is, that last part of the doctor's agenda. Get all your refills, get all your forms signed. If you're confused about something, you know, definitely stop and get clarification so that you truly understand what's happening and you're not surprised when you get home and you read the note, or when you look up a term online that they used. You know, ask in the moment, can you just go over that again? Or I'm not familiar with that word. It's good to book your next appointment that same day, because a lot of the MG doctors are booking up, you know, 6 months or a year to get in with. And so if you forget to book your next appointment and then time passes, you may not be able to get back in for quite a while. And then if there's any labs that need to be drawn, you would want to do that before you leave, especially if, you know, you're traveling to this health system, because you may not be able to get labs drawn locally very easily that then the doctor can get the results for. So that's me. If you're curious about kind of what I say to doctors, if you go to Spotify and search for the Murmurs episode, Check Engine Light, if you're a healthcare provider, you can kind of hear what I think about how to be the healthcare provider you'd want if you ever got really sick. So I talked fast. We're done in half an hour, so there's plenty of time for questions.
Thank you so much, Heather. That was a phenomenal presentation. I certainly know as a patient, so much of what you said resonated with me. And I think, you know, above all is that you provided really tangible tools and resources that patients or people living with myasthenia gravis can utilize during their next appointment. And I think it's even greater to have your expertise and lens as a physician to really understand, like that SOAP, that SOAP acronym. I didn't know that. And so just understanding that point of view is, I think, incredibly helpful, especially when you're working with your physician to try to make decisions about your care, and making sure that the conversation you have is to the point and effective. So we do have some questions. I also got questions coming in here for me. So perhaps you could answer this. When a patient's working with a doctor, specifically with MG, and they discuss pain, you know, I think a lot of people bring up pain as in whether or not it's related to MG. Do you think physicians automatically think, oh, well, that's not MG, that's not related? Or how is pain typically addressed in an MG patient, or just in general as a physician?
I think it's tricky in a couple ways. One, because it's invisible. And then the opioid epidemic has really changed the national dialogue on pain and treatment of pain. And some doctors have had bad experiences with patients who have substance use disorder. And I think that can unfortunately frame how they interact with new patients with pain. I think giving examples, you know, my pain keeps me from, I had to stop yoga. I can't walk through the whole grocery store anymore because my back hurts too much. I have to use the scooter. So I think, again, using really specific examples is helpful. Listing what you've already tried to help your pain is helpful. You know, I've tried naproxen. I tried this TENS I got at the drugstore. I think that can be helpful. If you don't want medicine in general, or you don't want opioids especially, you know, say that at the beginning, take that off the table. You know, you're interested in other medicines that could be tried. That's kind of in general pain. I think pain in the ER, it's a terrible place to get treatment for pain. Unless you think the pain is like a health hazard, the cause of the pain. It's a new pain, it's severe pain, maybe it's a heart attack, maybe it's an ulcer. But if it's chronic pain that you've had for years and years, the ER really isn't going to be super well versed in, you know, treating that, unfortunately. You'll just sit there a long time and maybe get COVID. So you know.
Well, we don't want that either.
And then with MG, I think it varies. I think a lot of doctors acknowledge that pain can be part of it, and other doctors don't. I think it really varies.
Right.
And I would say a lot of MG doctors probably don't treat the pain. They probably turf that out to PCPs or pain doctors or, other people. I think maybe they don't see it as part of their
Right. Scope
turf.
of practice. Yeah. And just to be clear, for those who don't know, PCP is a primary care physician. Um, so let's move on to the next question. That was great. Thank you. Let's talk a little bit about medical gaslighting. I think that's something that's a very hot topic in myasthenia gravis. I think for many people, especially their journey to diagnosis and throughout their journey living with MG. I know from my personal experience, hearing, anecdotal information about people saying, well, no, my doctor's just not hearing me or believing me or dismissing me. How do you approach that conversation with your doctor? Or I mean, I know it's a hard question, but like, how do you get someone who's in charge of your care to really hear you and to really meet you where you're at?
I think having goals and sharing them with your doctor when you come in are important. You can't get your goals met if they don't know what your goals are, and you don't know what your goals are. So I think being really specific about what you might hope to accomplish. I think the gaslighting happens more kind of in the pre-diagnosis and diagnostic odyssey, that 10 months or year-long process it takes on average to get diagnosed. And one thing, gaslighting doesn't mean they're telling you something that they just have a different opinion or they disagree with you. It's when they're telling you, that's not real. You're crazy. It's not happening. You don't have anything wrong with you. Proposing an alternative diagnosis isn't necessarily always gaslighting. It really depends.
Right.
But some doctors are just duds. So occasionally there's one who's just punching the time clock till they retire. And if you really think your doctor's not listening to you at all and they're just burnt out, you may have to switch doctors. And it may take a couple doctors till you find someone who listens.
Well, and it goes both ways, right? I mean, there's a tremendous amount of incredibly brilliant doctors who are wanting to work with you and wanting to solve, the problems and the issues that you face. So certainly, I never like to discredit any providers either, because there's many good ones out there too, as you know.
But it's not special. It's like any profession. There's great,
right.
There's middle,
Sure,
and maybe just not a good fit for you.
Right, exactly. Well, that brings me to my next question. So we have an individual who says that in addition to MG, they have another condition. Um, how do I guess you approach that conversation with your doctor when you're, trying to understand, is it X disease? Is it MG? How do you have that conversation about how those two diseases interact, how they play off each other? I mean, I think comorbidities is a common thing, especially in the MG community, and it's something that everyone faces, I think, as they continue to grow older as well. So how do you have that conversation with your doctor? What is it that the conversation centers around?
That's a really good question that I kind of face on a daily basis. When I'm short of breath or tired or have trouble walking, like, is it the MG today? Is it the POTS today? Is it this today? So I think it can be really hard as an individual to tease out what's causing what, especially when if you have one autoimmune disease, they tend to bring their friends, unfortunately. Kind of as the years go on, people pick up more and more. So yeah, it's really hard to figure out sometimes what is myasthenia and what is your comorbid condition. It's even harder when you might have doctors at different hospitals or doctors of different specialties like neurology and rheumatology or endocrine involved. I wish I had an answer to that question because I struggle with it all the time. Yeah. But I think maybe having like a running note in your phone of, what symptoms are going on or what major developments are happening, or keeping track of what responds to which medication the most. If you get rituximab for your myasthenia, which symptoms go away, and then those might be more likely to be myasthenia. if you get Humira for a rheumatology condition you have, what does that help? And sometimes I kind of like to get data if I'm having a flare up and don't feel well and don't know what disease it is. I'll look at my heart rate. I brought home one of those little NIF meters from the hospital that they just throw away. Any kind of objective data you can get is super helpful, because that goes in the O part of the note, the objective part of the note. And that's kind of like indisputable.
Yeah, that's great. And then doctors like numbers, they like data.
Yep. I see, and the question's going by me, what template and format for medical resume. I'm actually writing it down myself, because there is a format in how doctors write their notes. So your name and your demographics. So your name and your birthday, maybe your medical record number if you know it, but your name and your birthday. You can put a little picture of yourself in there. Your medicines goes first, and then your allergies, and then your diagnoses or problems. What other conditions do you have that will occur with your MG? Any major hospital stays or surgeries goes on the note. Surgeries isn't really relevant to MG, but the general note will have hospitalizations after that. There'll be lab work or imaging there. So your blood work or your EMG information.
I think it'll be great.
Recreating it in my head live.
Yeah, I mean, so many people interested in this concept that you proposed, and I think, it's such a good idea to create a resource around that, right? So just so people can just plug in like exactly what you just said. People seem to really
medicines, allergies, your major diagnoses, your hospitalizations or major events in your condition, and then your objective labs, imaging, things like that. So that can be really helpful for them to have all on one page, all in front of them right at the start of the visit, with your 3 goals, and like you're golden, you're ready.
This is an interesting question. What would not be useful to include in that summary? What would not be helpful or intuitive, I guess, to put something? Yeah,
don't bring the
amount of paper. Yeah,
keep that at home. What would you not put there? I mean, if you think it's really important for the doctor to know, to either understand your condition or help treat your condition, then it can go there. I mean, maybe your goal is, I want to walk down the aisle to, walk my child down the aisle at their wedding. If that's your number one goal, you can put that there on the top, your 3 goals. I think that's a great place to put your 3 goals and your 3 questions, actually.
I really love that. It brings back that personal, treating the patient or treating the individual and not just the disease, right? I mean, and especially with MG being so such a quote unquote, as we call it, snowflake disease, meaning it affects everyone so differently. I think having those goals at the forefront, those personal goals, would be super helpful. And Heather, if there's any questions that you want to particularly answer to, by all means, feel free. I do think there's a good question here about, when you aren't agreeing or when you're disagreeing with your doctor, how do you work through that? Like, how do you understand, like, your doctor sees it one way, you see it another? How do you kind of meet in the middle? Or do you have any advice?
I think it depends. If it's important for your 3 goals of that visit to have your doctor believe that particular statement or thought that you're having, if you need them to understand you, to help you with your goals, like you're saying, my fatigue is really bad, or my muscle strength is really terrible, and they don't believe that, and that's what you want treated as your number one goal, then that's a problem. You're going to have a dialogue for them to understand you. Sometimes if it's not super relevant to my goals and it's not going to harm me, if they're going to think something different, you got to kind of like pick your battles sometimes. If it's really important, then you're going to have some kind of dialogue. Well, but can we circle back to that? But if it's a more minor point, sometimes I just roll with it.
Yeah. Sometimes you have to, right?
Exactly. Yeah.
Let's see here. We have so many questions and I'm trying to address them all appropriately. Let's see here.
Oh, someone's asking what goals you're referring to. So they're your goals. So maybe your goal is my infusions are currently spaced 6 months apart, but I get bad in month 4. So your goal might be, how do I deal with those 2 months? Do I get the next infusion sooner? Do I take more of one of my other meds? Do I adjust something? That might be a goal. What do I do those 2 months when my infusion wears off? A goal might be, like I mentioned before, I want to walk down the aisle with my daughter. It's June, it's going to be hot, and I'd like to not use my walker. Maybe that's your goal. So they're your goals. They're not anybody else's goals.
See.
Someone is asking about how do you prioritize fatigue in your goals? It's weird. All autoimmune illnesses for the most part cause really debilitating fatigue, which I think if you ask a patient, what's the worst symptom you have or what is not being addressed at all by the medications that you're on, it's fatigue. It's terrible. It's very limiting. And some doctors get it and some don't because, when I talk to doctors, I say, autoimmune fatigue is worse than a month of nights fatigue. And I can say that for sure because I've worked months of nights, and autoimmune fatigue is worse, I would say, in my experience. But there's not great meds for it. So it's tricky. That's a hard one.
It's tricky. The fatigue is a common issue so many of us face, and it's a difficult conversation to have because I don't think the answers are always there. There isn't always a solution to some of these things, and it's difficult to address and treat. So, let's see what else here. There's one
Someone asked about where to find info about clinical trials. It's actually one easy website, clinicaltrial.gov. And then you type in what state you're in and what disease you're looking for, and it'll bring them all up and whether they're looking for new patients. So there's a lot of clinical trials for myasthenia right now, and every clinical trial in the US is listed at that website.
Yes, the clinicaltrials.gov is a great resource. We also make sure that our community and our stakeholders are aware of current research that's taking place in the community and making sure that we get the awareness and education out there about the different studies, because like you said, there's so much research taking place in the MG space, which is just super exciting. So let's see. There was one. Oh, I wanted you to speak to this a little bit if you can. Someone had asked about the non-physical challenges that are presented with MG, right? The mental health, our emotional well-being, the cognitive abilities. Again, I think neurologists, as we have discussed, sometimes they think, well, that's not in my purview, or that's not what I treat. So, but like, how do you make sure that those interactions and that comprehensive care is being maintained throughout your whole network providers, right? Or excuse me, your whole network of providers, because sometimes they're not always working in the same practice and they don't always have that communication. And you have to be an advocate and a liaison, and that can cause miscommunication. So how do you get the doctor who's treating your MG to really fully comprehend and appreciate those non-physical challenges with MG?
Yeah, I think one way to get other people to understand is, like I said, specific examples. I used to do the New York Times crossword puzzle in an hour, and now I forget what I went to the kitchen for when I walked to the kitchen. How severe is the brain fog? And it's tricky because there's no magic medicine for brain fog. I have brain fog. I like mix the slide order, and it happens. I have to have someone proofread things before I show them to the public. So it's tricky. And I think doctors like to be able to treat the symptoms and conditions their patients come with. So I think it's frustrating as a doctor when you can't treat something like brain fog or fatigue. And if you can't treat it, the doctor may deprioritize spending a lot of time on it. I don't tend to talk very much at the MG neurologist in that limited time about fatigue and brain fog. I have kind of a separate mental health component of my team. There's actually a field of psychology. They're called health psychologists or behavioral medicine experts. So they're psychologists who specialize in chronic illness and pain, generally, one or the other or both. You can find them on Psychology Today if you search chronic illness or behavioral medicine. And then they also have a professional association where you can find them. So I think for me, having a therapist that understands chronic illness has been hugely beneficial. So you may have to get support for some of your symptoms from people on your team other than the MG neurologist.
Great point. I think it's something that's often overlooked or tend to put to the wayside, but it's just as much of a priority as your physical health as well. Let's see here. So many great questions.
How often should you follow up with your doctors? That's a good question. I think it depends. And I think pre-COVID, it was a lot easier to get appointments in medical care. And now you have to wait longer sometimes to get in, and there's longer time in between appointments. I think that's frustrating for both patients and doctors. There's no great solution for that right now. I think making sure you schedule your appointment before you leave the office so that you get one as soon in the future as is possible, you know, when their schedule next has an opening versus going home and waiting a week or two or a month or things like that. So yeah, I think that's probably the best way. I see is there doctors who specialize in autoimmune disease. That is often rheumatology, but then there's also autoimmune neurologists. And there are, I would say the doctors that deal the most with autoimmune disease would be neurologists or rheumatologists.
Great. It's very helpful. There's a question about, you know, when informing your medical resume, so to speak, how many years back should you be going, especially when you're talking about hospitalizations or just significant medical events? How, like, is there a time frame or?
Yeah, I would say just a few years. Maybe list your first, if you had a crisis first and that's how you were diagnosed, then that would be important to have on your health resume. But I would say major hospitalization stays you can put there, and you know, the last few years is sufficient. And you don't write a lot about it. It's just, you know,
Right.
June 2020 MG crisis or
Right.
sepsis or whatever else happened to you that is important for them to know. Someone asked about giving this summary or resume to the doctor at the beginning of the appointment or before the appointment. The doctors still use faxes, you know, like it's the 1980s or something. So I often do, if it's a new patient appointment, send the one-page summary ahead of time, either through the portal, but you can't often portal a doctor before you've seen them. So I'll fax it to their office and just say, you know, here's my name, here's my birthday, so they can find you in the EMR. Here's one page. Don't send more than that. One page summary, and it saves them a little bit of time hunting through the medical records. So, and if that doesn't work out just tech wise, because I mean, it's hard to fax because it's 1980s technology, just bring it and show them your top 3 goals and top 3 questions when you get there. Make 2 copies, one for you and one for them when you go to the appointment.
That's great. That's very helpful. I think this is, I do want to answer this is, and feel free to say I don't want to answer this, but this is a bit of more of a personal one. You know, you shared briefly about your journey to your MG diagnosis, which was, I think, as heartbreaking as it is to hear that you went through that. It's not an uncommon experience, unfortunately. And many people have experienced similar situations. So, you know, during those early years and days of trying to navigate and find a diagnosis, how do you sort of make sense of it all? How do you keep your mental health in check? I mean, when you're constantly getting, you know, as this individual says, must have felt like you were hitting a brick wall many times. You know, how do you keep persevering and pursuing something because you know that something is wrong?
Yeah, it's hard. The couple years before the neurological Sjogren's diagnosis and the couple years before the myasthenia diagnosis, there were times that were, you know, really, there were some really dark days in there when, yeah, you hit the brick wall. Like, where do I go next? I've done everything I possibly can. I've had every test and it's all normal, 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 and they don't seem to care anymore. You know, when I was having a really hard time breathing laying down, and that's not normal. I was sleeping against the headboard. That's not normal, but Different doctors would kind of do the tests that they usually run and then kind of like, okay, it's not my department. But it was nobody's department that I couldn't breathe laying down, and no one was helping me with it. And that was really challenging. Um, it took a while until the right test was noticed or the right symptom was noticed. And then everything kind of happened after that. I think the support system is really key in those years. So for me, the health psychologist was really important. My family was really important. And kind of rallying yourself when you start to get down to try to start the medical struggle again. But I think it's also fine if you need to take kind of like a medical break. I've had to do that, like I just can't see another doctor. I need a month of no doctors. That's okay too. And then when you've had that recovery period, pick things up again and start the diagnostic odyssey, as it's called. And, I think it's more the rarity, the people who are diagnosed quickly. I think it's a bit of a journey for most.
But hopefully with more awareness and education and research, we can hopefully minimize that diagnostic odyssey, so to speak, and not have to have these lengthy diagnostic journeys. There was a question I think that you wanted to address that I
Someone asked about supplements. Should that be on the list of medicines? If you take it every day, it should be on the list. There are certain supplements that can interfere with medicine. And so, your doctor should know about that. So yeah, supplements definitely go in the medication part of the summary.
Yeah, I think that's a good point, especially because I think people might be, nervous that they say they're taking something or, don't want to admit that they're taking something. Not that it's a bad thing to take, but I think supplements can be, controversy, but it's only going to help you to say what you're taking in efforts to better care for yourself. So
not being honest doesn't usually help. So you really need to be honest with the people on your team about what you're doing.
Exactly.
Particularly if you're having anesthesia. Anesthesia is risky enough if you have MG, but there's certain supplements and drugs that if you're on them and you get anesthesia and the anesthesiologist doesn't know about it, it could really be a life threat. So it's really important to be honest about, what you're taking and doing every day.
That's a fantastic point. I didn't know that there was an interaction there, so that's incredibly helpful to know. Let's see here. I think we can probably do a couple more questions if you're up for it.
Yeah, someone asked, my PCP knows nothing about MG. How can I get my neurologist to talk to my PCP so that referrals and all the rest of that? So when you see a specialist, the note that they write that goes to the EMR also gets sent to generally the PCP and whoever referred you, if that's not your PCP. So they're getting the note, but they may be getting 200 notes a day. A lot of doctors, primary cares have a panel of 1,000, 2,000, 3,000, 4,000 patients. So they're getting hundreds of inbox messages every day. So it's tricky. They're getting the info from the neurologist, but they may just have inbox overload and not be able to get to it. So it's tricky. There's kind of like a primary care crisis right now. And if you have a chronic illness or a rare illness or you're, medically complex, it can be challenging.
Yeah, and I think just, living in this digital era, it has its pros and cons too, right? Speaking of electronic health records, we have an individual that said, if you're not using the, EHR, how to organize this information and keep track of it. I know I can personally attest to, we have a great resources at the MGFA, including our mobile app, as well as the registry that you can sign up for and utilize that when you are having conversations with your doctor, because it helps you track your symptoms, helps you have access to the notes you've made about XYZ symptom or how you were feeling that certain day. And so having those tools in your toolbox is incredibly, I think, resourceful and helpful. I know it's helped me aid the conversations that I have had with my doctor because it also helps you, it tracks patterns, right? You're looking at patterns and that data and trends over time. So from a digital perspective, that is certainly a great resource. Heather, did you have any recommendations or want to add anything to that?
Yeah, I think if you're not a digital computery person, then yeah, I do have a paper kind of medical journal too. And I have a section for when I start and stop medicines, because that's important to know. If you have a flare up or you have uh, a side effect, to know when you started or stopped certain meds. So I have a section in this paper, journal about meds. I have a section for, when I had major tests so that they can find them in the computer. Like June of 2020, I had my XYZ. Um, I put info from a doctor visit, the date of the doctor visit and the doctor's name and what happened at that visit. So I think paper's a great way too. And then just have a handwritten health resume or summary where you kind of go through your journal and add those elements. I'll actually make a draft of one and send it to you, Meredith.
Yeah, it'd
Just
be great to
kind of see a
collaborate.
picture of what this is like. And it's
Yeah,
not my original idea. I stole it from someone I saw years ago on the internet. If this was your idea, I send me your name and I'll give you credit because I think it's fantastic. I saw it on the internet a few years ago and I've done it since, and I think it's been really helpful.
it's really helpful too, especially when, like you had mentioned about meeting a new doctor, right? And sure, your electronic medical records are sent over, but are they really going to read through those hundreds and hundreds of pages? No. So having those key points to be able to say, this is what I have, this is what's going on, this is what has affected me, um, just only helps with that conversation because of the time that's so limited with your doctor already. I just want to say you're getting a tremendous amount of comments. By far the best visit to MD presentation I've seen. Thank you. I think it goes to show you just, how important this conversation is, Heather, and just having, like I said, your perspective and lens, both as a physician and as an MG patient. I like your quote about being on both sides of the exam table, and it speaks to, I think, so many of the things that we experience as MG patients, and how important it is to have a solid relationship with your physician. And if you're not taking the steps to make sure that it is a strong and useful and productive relationship. Did you have anything else you'd like to add?
No, thank you for having me. And I was happy to be here.
Yeah, thank you so much. Thank you. Thank you to everyone for tuning in. It's just so happy to see so many people engaged on this topic. There were many questions that we weren't able to get to. That said, I'm going to, if there's specific ones that, I can circle back with Heather about, we'll certainly try to address those, and maybe write in a summary email or something of this sort. Or if you have a specific question and want to reach out to me specifically, you can email me and I'd be happy to try to find that information for you. So, all right, everybody. Heather, thank you again. It's been a pleasure, and take care, everybody.